How to differentiate between the flu and coronavirus. Both COVID-19 and the flu are viruses that present similar symptoms, and it can be difficult to tell them apart. This can cause a lot of anxiety if you're feeling sick and don't know what to do. While the only certain way to tell the difference is to get tested, you can still review your symptoms and make a good assumption about what's wrong. If you do get sick, it's best to talk to your doctor and follow their instructions on what to do next. Method 1: Symptom comparison. 1. What symptoms are common in both the flu and COVID-19? The two illnesses are quite similar. Both are spread through viruses, usually via water droplets in the air from an infected person, and they share several symptoms. Both often involve fever, chills, sore throat and cough, fatigue, headache, and body aches, nausea and diarrhea. 2. Does the flu or COVID-19 cause a runny nose? While nasal congestion can occur with either virus, it's much more common with the flu. Only a small number of COVID patients report having a runny nose. If you have a runny nose along with other flu-like symptoms like body aches, fever, and fatigue, then it's a good bet that you have the flu. If you do have congestion or phlegm, it will be green, yellow, or gray with the flu. If it's clear, then you probably have allergies instead of a virus. 3. Which virus causes a loss of taste or smell? This is a common, early sign of COVID-19. It usually occurs very suddenly, and probably before you're feeling very sick. The flu does not cause this, so if you have this symptom, then you're probably coming down with COVID-19. Having a very stuffy nose from a cold or allergies could also affect your taste, but with COVID, this would happen without congestion. 4. Are breathing issues more common in COVID-19? Yes, this is a typical symptom of COVID rather than the flu. A COVID-19 infection commonly involves shortness of breath and respiratory issues. Breathing problems usually have a slow, gradual onset. The flu is a respiratory infection too, but breathing issues are less common with this virus. You might notice more difficulty breathing if you're exerting yourself or walking up the stairs. If you do have trouble breathing, call your doctor right away. This could be a serious symptom. 5. Which virus takes longer to develop? COVID usually develops more slowly than the flu. While the flu usually causes an illness 1 to 4 days after infection, COVID could take up to 14 days. If you've been around a sick person and develop symptoms quickly, then the flu is more likely. If your symptoms take a week or more to develop, then it's probably COVID. This characteristic might not seem very useful if you didn't realize you were around a sick person. But if you know a specific event where you were in contact with a sick person, then it can be a helpful guide. 6. Do children get sick with COVID-19? As a general observation, COVID-19 usually doesn't cause a severe illness in children, while the flu often does. If your child is under 10 and they're fatigued, coughing, feverish, and complaining of body aches, then the flu is a more likely culprit than COVID. Note that this is just a general trend, not a scientific rule. While they usually get a less severe case, children can still contract and spread COVID-19. 7. What else could cause symptoms similar to the flu or COVID? Colds and seasonal allergies could also be mistaken for a COVID-19 infection. Stress and panic attacks can cause symptoms like shortness of breath, headaches, and fatigue, which can also be mistaken for COVID-19. However, when you look at the other symptoms, you'll see that they're very different from COVID-19 or the flu. Cold. A cold usually involves a runny nose, congestion, a sore throat, a mild or moderate cough, and/or chills. Colds rarely cause fevers. Seasonal allergies. Allergies usually involve fatigue, coughing or sneezing, and a runny or stuffy nose. Your eyes and nose will probably be itchy, which is a telltale sign of allergies. Anxiety attack, chest pain, heart palpitations, nausea, feelings of panic or fear, sweating, numbness of hands and feet, dry mouth, irritability, and muscle tension are typically signs of anxiety or a panic attack. These are short-lived symptoms that last 5 to 20 minutes in most cases. Tip: If you're sneezing or have a runny, stuffy nose, it's probably not COVID-19.